Here at CBS News, we're committed to stopping the stigma surrounding mental health so we can take the shame and the blame out of discussing mental illnesses. Today, we're looking at how racism and the coronavirus have affected mental health in the Black community. Only 1 in 3 Black Americans who need mental health care receive it. Psychiatrist Dr. Jess Clemens uses her Ask Dr. Jess social media account. She's great to break down barriers and provide more access to help. She joins us only on CBS This Morning from New Orleans. Dr. Jess, it's so good to see you. You are the perfect person for this conversation today, because between COVID and heightened racial tensions, I think about what Black Americans are living through these days. Listen, one of those would be enough to put you in the fetal position, but you've got the 1-2 punch. Talk about why this is having such a big effect on mental health in the Black community. It seems obvious, but maybe not so much for some people.
Absolutely. So thank you for having me today. I think what you're pointing out is something that Black Americans know intuitively, right? We know that we're always hit the hardest and we have the worst outcomes, right? But there are a lot of studies that actually have looked at how racism specifically affects the mental health of those within the Black community. Right now, thinking about, George Floyd and police killings, there was a study in 2018 that looked at what's the impact in terms of mental health for Black Americans who are living and observing unarmed Black people being killed. And what we find is that for the larger Black population, that equates to about 55 million poor mental health days, which affects the economy and obviously affects the quality of life. And what we do know about COVID and natural disasters is that it tends to lead to an increase in the number of new cases of mental illness. And so, of course, when Black people get exposed to things like this, we are expected to get hit the hardest, right? So we're expected to not only present with symptoms, but also have nowhere to go because of the lack of access and the stigma and barrier associated with it.
Yeah, Dr. Jess, you've also talked about the difference in diagnosis. A Black man and a white man can go seek mental health for the same symptoms, but they get a different diagnosis. What do you mean? Yes. So there have been, again, a lot of research that have shown if, let's say, a Black man goes in to see a psychiatrist with psychotic symptoms and a white man goes in to see a psychiatrist with the same psychotic symptoms, the Black man is more likely to be diagnosed with schizophrenia, which in society has, a larger negative consequence associated with that. And the white man is more likely to be diagnosed with bipolar disorder, which is an illness that is thought to sort of have to be episodic, to have periods where the person is experiencing psychotic symptoms, but otherwise with treatment to sort of go back to normal. And so again, that's very different in terms of how society views them. But also I need to add that African-American or Black patient is more likely to not get treatment and to be incarcerated actually because of those symptoms. Yeah, and there certainly still is a stigma in the Black community about seeking mental health. People say, go to church, talk to a friend, talk to your family, or better still, keep it in the family, don't take it outside the family. Do you think that's changing? Are you noticing more Black Americans seeking help? And how do we reduce the stigma?
Absolutely. Well, I think, because of my sort of unique work using social media to engage communities, Black community around mental illness, I certainly have received a lot of direct messages from people who have started to engage in therapy or are looking for a therapist. So I think there has been a lot of work in terms of reducing stigma. We have a lot of celebrities that are very open about how much therapy has helped them. So I do think that we're going to see a rise in that. But, there still is a lack of Black psychiatrists. There still, are far few Black psychologists. So my hope is that this will also encourage people to pursue this line of work, because we do know that Black patients are more likely to get treated by Black providers, and that Black providers are more likely to work in communities that are underserved, in the Black communities especially.
Very good point, Dr. Clemens. So how do you stay strong and sane when you feel so broken inside?
So I think, that's the million-dollar question. My hope and a lot of what I encourage people to do, including my own patients, is to find things that bring them hope, to find the things in their life that make them feel good, and really to lean into that. I think, with working from home and social distancing, my hope is that people have really leaned into the love that they can receive from their families, really engaging in things like breath work, yoga, meditation. Those can all be things that a person can do to sort of help sustain them. And as we continue, this fight for racial justice and also to get out of this pandemic.
to get out of this pandemic and be with people. Listen, I was with friends over the weekend in Long Island, something I hadn't done in a very long time, and just being in the studio surrounded by people. You must feel this too, Anthony.
Totally.
Makes such a difference. Makes such a difference in how I feel. Lighter already. Dr. Jess Clemens, thank you so much for taking the time. I really, really appreciate it. If you or someone you know is seeking mental health resources, you can call the National Alliance on Mental Illness. The mental illness helpline is what she's trying to say at 1-800-950-6264, or in a crisis, text NAMI to 741-741. Anthony?
Yeah.